I'm Dr. Sharath, a cosmetic plastic surgeon at KIMS Kondapur, and today I'm going to speak to you about rhinoplasty. Rhinoplasty is a surgery to change either the form or function or form of the or shape of the nose, which would improve his or her confidence and ability to breathe sometimes, which might benefit the ability to breathe also. Have yourself assessed by a plastic surgeon who is experienced in this procedure and you're confident about. The plastic surgeon will examine your nose, look at what is the problem with the nose. Is it the bony framework? Is it the cartilaginous framework? Or does it, and what sort of correction is required? Taking you into confidence, he'll explain to you about the procedure. Also, if you're on any blood thinners, they would advise you to stop them at least 2 weeks prior to the surgery, taking your physician into confidence. Open rhinoplasty is wherein a cut is made at the bottom of the nose and in an area called columella, and the skin envelope is lifted up and a correction of the nasal tip, cartilage and bony framework is undertaken and it is stitched back in place. Now, closed rhinoplasty is wherein you approach the nose, skeleton of the nose through cuts made inside the nostrils and go in and do the surgery and close those wounds. Also, there is another rhinoplasty called a filler rhinoplasty, which is wherein fillers are injectables which are injected below the skin and correct contour deformities in the nose, but these need to be repeated because the filler resolves after 6 to 9 months in certain individuals. When doing the rhinoplasty, the surgeon might use cartilaginous grafts which are taken from the ear or from the chest wall to enhance the form, or sometimes the septum, that is the midline skeletal support of the nose, also might be used to reconstruct or improve the shape of the nose. And in some individuals, nasal implants are used to augment the dorsum, which if it is hollow or misshapen. Normally after the surgery, depending on the correction done, sometimes the septum might also have been corrected along with the rest of the cartilaginous or bony framework. Your nose will be packed with an appropriate material to make sure that there is no bleeding and to make sure that the mucosa of the septum sticks back to the septum. If there is an osteotomy done, that means the bony pyramid has been realigned. You will also have a nasal splint to be in place for the initial few weeks. The nasal packing will be removed after 24 to 48 hours depending on the surgeon and the surgery involved. We would advise you to avoid loud strong sneezing and strong blowing of the nose after the surgery and chewing of hard difficult objects in the initial few weeks. You might also be asked to use a nasal spray for the initial 1 week to 2 weeks to prevent any blockage of the nostril and to keep the nose clean. Rhinoplasty corrects any problems with the form, and also in some people with airway obstruction or unilateral or bilateral, the septal correction might lead to improvement in their symptoms, and some people snoring also is corrected by this surgery.